Today's podcast is about suicide. If you or anyone you know may be having suicidal thoughts, please call and ask for help. Please contact the National Suicide Hotline 1-800-273-8255 or 998. You can call us here, Yakama Nation Behavioral Health, 509-865-5121, extension 7633. In an event of emergency, please call 911.
Welcome to Understanding Behavioral Health. Hutch Tachotriak, Kwela Ale Babajo. Hello, my name is Babajo. Good afternoon.
Sheikh Pachwai, Inknashwaniksha, Istimachwayama, Kushiaputumki Jeremy Garcia. Hello, everyone. My tribal name is Istimachwayama, means young eagle, and my English name is Jeremy. I work at Yakama Nation Behavioral Health for the Suicide Prevention Program.
Sheikh Pakshwe, my name Iknakmaniksha. My name is Christal Brown. I am the project manager for Zero Suicide.
So we're here with Christal, and basically we just want to get the feel of what Zero Suicide is. So what is Zero Suicide?
So Jeremy, if you can pull up this page, I just want to kind of have an overview and then we can talk about it.
Okay.
So mission statement for Zero Suicide: because one life lost is one life too many. Our core values: we are committed to the belief that suicide can be eliminated among our community by improving service access, quality, and through practicing continuous quality improvement. Our goal is to be open and dedicated to change that improves our service in suicide prevention care. Zero Suicide is based on the following foundational principles, which is LEAD, a system-wide cultural change committed to reducing suicide, to train competent, confident, and a caring workforce, identify patients with suicide risk via comprehensive screenings, engage all individuals at risk of suicide in a suicide care management plan, treat suicidal thoughts and behaviors using evidence-based treatment, transition individuals through care with warm handoffs and supportive contacts. So that's kind of a basic overview, and you can bring that down, Jeremy. So that's kind of what's this. It's a basic overview of what Zero Suicide is. So it's a systematic approach to suicide prevention and suicide care. For me personally, I viewed suicide prevention as someone walking and marching on the street saying, or having walks. But this is a way that we can change and improve our care for our community through policy and procedure change. And that's exciting for me.
Well, I like the way that you explain that when we typically think about suicide prevention work, we usually think about certain outreach events that take place in the community, like walks, or for myself, I work for the Native Connections Grant, which also focuses on suicide prevention. And every time that somebody asks what I do for work, and I tell them I work for the suicide prevention program, they immediately think that I'm either a counselor or that I answer crisis line phone calls. And so then I have to explain to them, which I think would be good for our audience to be aware of. There are kind of like two categories of services. So one category would be direct services. That's where we're providing services to the community. That would be something like at Yakama Nation Behavioral Health, we have therapy services. So somebody could come in and talk to a therapist and have some sessions. But there are also indirect services, which is more along the lines of what Zero Suicide is. So you're not necessarily providing a direct service to the community. You're working more so within the program to make sure that make sure that the program is functioning smoothly and efficiently. Would you say that it's a good explanation?
I think that's an excellent explanation because we're behind the scenes of a lot of different circumstances for the direct services programs, as Healthy Transitions, who you guys spoke to last week, and SOC, who you guys spoke to before, and our clinical staff who work with people on a daily basis. So we're behind the scenes making policy and procedures on how we handle people when they walk through the door. And if they're having suicidal thoughts, we want to make sure that we're equipped to know what to do. And not only that, but for people who are sitting at the front desk, someone comes in, you're answering the phone, we want them to feel okay. Just the topic of suicide is kind of a stigma of like, oh, don't talk about it, you know. But Zero Suicide says, let's feel comfortable, let's talk about suicide. So it's, yeah.
Right. So, from my understanding, you train the other employees that work at behavioral health. Is that what I'm hearing as well, or?
Yeah. So we have. I don't know if you want to pull up the training one. I can talk about it just for a second. While you pull it up. So the training for clinicians. We're implementing required trainings for all staff and specific trainings for our therapists. For example, the DBT training, it's a dialectical behavioral therapy. It's a type of talk therapy for people who experience emotions very intensely. And as you know, suicide is an intense feeling. It's common therapy for people with borderline personality disorder. But the therapists provide it for our mental health conditions as well, or other mental health conditions as well. And then the CALM training, which anybody can take. You can probably go to the Zero Suicide website. It's counseling on access to lethal means. And then the badge training, and then postvention training. So those are the specific training, and that's the training aspect of the 7 elements that we talked about before, that we want our people to be equipped. We want them to know what they're doing when someone walks through the door. We want the clinicians to have their trainings. We want the lay staff or non-clinical staff to be equipped and feel comfortable when someone walks through the door. So, yeah, it's a big aspect to what Zero Suicide provides.
Okay. All right. Well, so when we're talking about I heard some of the things that you do train, and the badge is the main one, because I took the training as well, so I like the training, and I use the badge quite a bit, and the calm part too. I like that. So can we go into more conversation about what the badge is, and then also the calm a little bit?
Okay. So, that's a big topic. So the badge training is something that came to my mind when first of all, I know the question hasn't been asked, but when Zero Suicide came to the table as something that was going to be my job, I started to research and look into things and saw on the website, I was like, what could we do better? Well, I was a healthy transition facilitator before I took the Zero Suicide position. And the issue is we have an intake where we do screenings for the people that we see. And when we had an encounter with somebody who screened in, it was like freak out, don't know what to do. And I listened to people. So when I got Zero Suicide and was thinking all the different kind of experiences that people were having, and when I was doing my research, I ran into this part on the Zero Suicide page that said the badge. The badge is something that you carry around, and if you happen to have, and it's for non-clinical staff specifically, that you can just have something right in front of you when you encounter somebody, and that you can ask the questions. So I started researching, I started talking to our UW researchers, and they helped me put this together. I went and interviewed different clinical people. Our clinical director did in-depth training. Jeremy was a big part of that because I bounced off a lot of questions with him, and there was a lot of ups and downs of thinking, is this something we should do? But I kept getting confirmation after confirmation of people who regularly would fill in for like the front desk position. I would be like, how would you feel about having a tool like this where you can ask questions and then have a pathway or a process to get this person the help they need fast-tracked to a clinician? Because we're just non-clinical staff. We want to make sure that we can just ask the question and we can fast track it. So the badge was the beginning stages of that. And so when I did the research, I was given the Ask 5 screener, which is a specific suicide screener for 8 and over. And then I implemented the PHQ-9, which is a patient questionnaire, and that's a specific depression screener. So that's basically what the badge is. The reason I used the badge as the title, because that was a lot of reasons I had a lot of flack of like, what's the badge? Well, the badge is this. Why don't you just call it a screener? Well, because, you know, we're a trauma-informed care, passionate, driven program. And so when I say badge, you ain't thinking, what are you doing to me? What's wrong with me? You know, the badge is the badge. And, you know, hey, you know, can I help you? I have some questions. I have this badge. I want to see, you know, if we can work together. And so that's what it is. If it's approachable. If I were to say, hey, you know, I want to do a screener on you, you know, how do you feel? You know, it's just different.
Right.
And so, and I began to have understanding when people came to my training and they were like, oh, now we know why you call it the badge. Yeah, that's why I call it the badge. So going through the badge and the beginning stages of the badge, I've trained all of our staff on the badge. Now it's just integrating it, and I was able to integrate it into the self-harm risk workflow for our non-clinical staff, for SPU, for VRP, and then we kind of ingrained it into the clinical staff at-risk self-harm workflow. And so now it's also being a part of implementing it as a policy and a procedure that we actually use and do. So it's in the beginning stages. I've seen it be used a couple times, and it's running its course. It's a paradigm shift, and it's a different way of thinking. It really is. So I'm proud of it. I'm excited about it. I just want it to be something that comes into fruition, into a regular way of thinking with our people. So I'm really excited about it.
Right.
And I have one thought to that. So obviously I think, you know, when I was talking about it with Jeremy, I was always excited about it. And I was like, you know what, Jeremy, I'm so excited. This could be such a big thing. This could go to the Yakama Nation. People can, you know, walk into any program, have this screener, and, you know, we could really, really emphasize the philosophy of zero suicide. And what is that? To eliminate suicide in your community. Wow, that's like an amazing thing. And that's how I'm kind of a dreamer. So I guess maybe I'm perfect for this job. I don't know. But, you know, I was kind of sharing that with Jeremy, and Jeremy was like, yeah. And Jeremy's like the one brings me down to earth. Okay, let's try to put it into our own program first.
Right.
And then, you know, expand to the community, which I'm excited about. So,
yeah, one of the things that I like about the badge is that it gives you a step-by-step plan to follow for when somebody, anybody who's coming into behavioral health for services, if they're having thoughts of suicide, this gives staff a step-by-step process to go through to know what to do in that case. So as you guys already know, I'm also a certified QPR instructor, which is a training that teaches the steps to take when somebody's having thoughts of suicide. And one of the things that we cover in that training is that having conversations about suicide can be an intimidating thing to do. It can be a scary thing to do. And I know that when I first came on to doing suicide prevention work, it was something that I was nervous about as well. And what really helps me overcome that nervousness and that fear is having a plan. It's like knowing what to do. So that's what I really like and appreciate about the badge is it just lays it out. It's a very simple step-by-step process for all of our staff to be able to engage in. You mentioned so Zero Suicide is the name of the grant. Can you tell us a little bit more about what that name means and how that came to be?
It really believes that you can eliminate suicide in your community. It means that suicide is preventable, and I believe it is. Suicide can be preventable. Me and Jeremy did a presentation for kinship care, and it's hard because our community is wounded. So when you say suicide can be eliminated and they've had that tragedy happen in their life, and they're saying, I blame me. I could have noticed, I could have seen that. While you empathize, nobody should ever blame themselves. But we can also say there's hope. We are out here to say, we're here for you. It's not your fault. We're here to want to bring 0 suicides to this community, and we believe it could happen. We had a grandmother who's taking care of her children, her son's children, and her son committed suicide. And she said, is suicide hereditary? What a question to ask. And it's hard, when someone's hurting and they want to have a real answer. And she said under her breath, but I heard it. She goes, am I basically raising kids to not be around it, eventually? And I was like, it's, you can prevent suicide with your son's children. It's not something that has to be in their life. And then Jeremy had a great follow-up story with that lady who, after we talked to her and told her it's not hereditary, it doesn't have to continue on with his kids. And so Jeremy actually had some follow-up with that grandparent, which was with, you want to tell him
Yeah. So at this kinship dinner, there were a number of different people who, we gave a presentation about suicide, and there were a number of different people who spoke up and shared some thoughts and feelings and concerns related to the subject of suicide, and was really appreciative of people's feedback. So one of the grandparents ended up reaching out to me and taking a QPR training the next day, which I thought was great. Just, the fact that she had the desire to come in to utilize the available resources and learn more about suicide and how you can prevent that. I really like the mission statement for 0 suicide, that it says, because one life lost is one too many. And that's great, because oftentimes when we talk about suicide, one of the first things that we think about too is like statistics, and what are the statistics for this area versus that area. But at the end and those numbers are important. Those numbers do matter, and they do mean something. But at the end of the day, we're talking about people, and we're talking about people who, people and families who are impacted. And losing anyone to suicide is definitely a tragic event. And so that's something that we want to work within behavioral health to make sure that our program is operating as effectively as possible to be able to, again, like you mentioned, to be able to eliminate suicide entirely.
Yeah, absolutely.
So, you may have answered it a little bit already, but what made you decide to take on this position that you're in now?
Okay, so like I mentioned before, I was doing healthy transitions. And so before that, I hadn't worked with people for a while, and I missed it. I was like, man, I want clients, I want people, I want to make a change in someone's life, So I just applied for Healthy Transitions and was excited for that, right? So I was working, I think I was in Healthy Transitions for a good 5 months or so, when I had this big old binder plopped on my desk and was like, tell me what you think about this and tell me if you want to take over. And I was like, okay. And so I looked at it, saw 0 suicide, opened the binder. I read a few lines, and I got up and told my director, I want to do it. And she was like, what? She was like, are you sure? And I was like, yeah, I want to do it. And she was like, okay, it's yours if you want to look into it. And, there was factors that weighed with that. Okay, so I've been working in the community for a really long time. Not to give my age away, but I used to work in schools. That was a passion of mine. Actually, I have a degree in social work. Worked for the state as a social worker. Had a big old caseload of Native students who were just failing in school, and it broke my heart. So I got into the school systems because I'm like, I'm going to change the world. Okay, that's my perspective. If there's a theme, I'm someone who thinks they can change the world. So I got into the school system, and I was like, I'm going to make these kids successful. Developed a after school program, worked with the kids, had many years of that, and then got involved, and then got out and got involved, became a social worker again, and ended up having a lot of students who I would know through the years commit suicide and die. And it broke my heart. And so I was like, I can't have this. I have to do something. There was a section, a period, I think in 2010 is when it was, where we were literally having a suicide every month. And I knew probably almost all of them. And I was like, something needs to happen, you know? And so I took it upon myself to do community outreaches. This was before Kathy and all her millions and amazing programs. It was just people doing grassroots stuff. We didn't have money. I fundraised. I got our own stuff and started having groups where people would talk about their losses. And it was a good feeling. So I've had a deep-rooted passion for suicide in the community because I know, even over the years, a lot of the kids who have committed suicide. And so when she plopped that on my desk and saw that it said zero suicide, saw the philosophy that it wanted to do and implement, I was just, it's a perspective I've never heard. To be a policy changer, that changes things. For a program that sees a lot of people in the community, I was like, I want to be a policy changer. That is an amazing way to do suicide prevention, in my opinion. So, but yeah, I mean, here I am, you know, it just kind of happened, fell in my lap. But that doesn't mean it wasn't meant to be and that I wasn't supposed to do this. So I think everything happens for a reason. So.
Right. And I believe, you know, personally, when you're talking about suicide in general, even asking questions, even if you don't know the answer to it, you know, I try to ask questions. I know there's quite a few questions that people ask, and like you guys said before, one of the elderly ladies asked, you know, is it hereditary? And then, and you guys talked about there could be, you can prevent it. You know, is there any good tools or even self-care things that somebody could do to help with that?
I mean, the only thing that we can do as far as the tools, I mean, we have the community training, is that's the awareness piece. That's the outreach piece. We go out, do presentations to the community, to let people know. Because, you know, after there was a few comments, you know, and I came back with, you know, with understanding, but to say, I strongly believe and have a passion for zero suicide in our community, and I believe it could happen. All you got to do is open the door, and we can bring the opportunity of the tool of the QPR trainings, help people ask the question. Like I said, I want to bring the badge to the community and let that be something that people could use, whether they're going to go and use the actual crisis line, or if they're actually going to walk through or use our program as a service. I think those are the kind of things that come to my mind. So, I mean, for now.
So, you were just mentioning that you want to try to bring the badge to the community. So, any other programs around the Yakama Nation, or that's in the Yakama Nation, if they were wanting to do the training for it, are they able to, or is that something that's in the works?
I think it's still in the works because it's still in the stage. So we're like in the first year stage of developing the badge, and so we want it to work within our own program. We want it to work like a good old oiling machine, and there's gaps in service, and that's a big part of zero suicide, is closing the gaps in quality improvements. What could we do? We implemented this policy, we implemented the procedure, and now let's get everybody on the same page. And that's a work in progress. I can openly admit people are having opinions and having views that are like, are you sure this is what I do? Or is this a policy? And we all just need to get on the same page. And there's a lot of advocacy in that. So I think once we get it working in our own system, I want it to be good, because if it goes out into the community and it's not good, where's the hope in that? People are going to eventually not have hope in that service or tool. So you did mention that so our whole program has been trained in lethal means. So the statistics is being trained in lethal means, which means we're being trained to identify if someone is identifying as have suicidal thoughts or they are wanting to kill themselves, that we want to say, okay, we need to eliminate lethal means. What does that mean? Anything that someone could use, they could either identify it in their speech where they could say, I have a gun out back, and I want to use it eventually. You can say, okay, what lethal mean are we eliminating? Well, the gun that's out back, because he said he could use it. Or you could say, my mom does, sometimes everybody doesn't use it. So the questions can be asked with parents, with the adult. So do you have access to medication? Do you have access to a firearm? Do you have access to any other element that could be in the room that you could talk to the parent? And if they could bring up a conversation and talk about something, you take away that lethal mean and you reduce the resource that they could use for that. So, our whole program has been trained in that, but anybody can go to the Zero Suicide website and take the CALM training. That's what it's called. Type up Zero Suicide, type in the little search, CALM training, and anybody can be trained in lethal means. So counseling and lethal means.
So I know in the past, typically, in the native country, people don't really talk or even ask questions, and it's something that we're trying to help eliminate, because we want the people to ask questions and have these conversations, even if it's just with their parents, right? And even with each other. But that's what we're here for too as well, right? We can help out with whatever questions people have. And but the badge is more focused on finding those, I guess, triggers, I guess.
I think the badge just is, if you're non-clinical and you have no experience in identifying, oh my gosh, what is this? So we train you on the basics of it, but don't try to assess or determine. Good example is, okay, here's a good example. So there was this lady who had someone talking to them and saying, I'm so stressed, I just basically, I want to die. And in her mind, she was like, this lady's high risk. She wants to kill herself. And she said, okay, she goes, would you mind answering a few questions for me? And that lady said yes. And so she went through the badge, asked questions, and she ended up being at moderate risk. So she wasn't at the level of high risk. She was at moderate risk. The badge is scientific. It doesn't go off your feelings. It doesn't go off your emotion. It doesn't go off whatever you're thinking in your mind. It's a tested and approved screening tools that work together to assess somebody to see where they're at in their mindset. So once she knows that this person's at moderate help, she knows what to do next. We have a policy and procedure that says, okay, this person's screening in at moderate risk. This is what you do. You can give them to a professional who can then do a safety plan and make sure and call them that it's something that doesn't escalate into more, but make sure they're making that reach out and communication. How are you doing today? Until, if they choose to enter services, until that first appointment. So that's kind of basically how the badge works. And I feel like that alleviates me trying to figure this out. Because it's better safe than sorry. Because if you do this assessment and they're perfectly fine, then you stay connected to them as a client, obviously, in your case management. So, yeah.
Okay.
One of the good things about the badge as well is that, so there are varying levels of suicidal ideation. So when a person, so kind of at the start of it, when a person begins to have ideas about suicide, they're maybe thinking or feeling like they wish that they were dead. At that point, they're just thinking about suicide, and then at some point that will progress further and further until there's a point where they make a decision that they're going to attempt to take their life. And so, for us as people who provide services, we want to know where the person is at on that scale. Are they thinking about suicide, or have they made a decision that they want to take their life? And having a good understanding of where that person is at helps us to decide what the next best steps are to take with them to help keep them safe. So the badge tool helps us evaluate where that person is at on that scale of ideation.
Yeah, and something that's new that's being implemented with the badge, that is a new policy and procedure that we're implementing. Hasn't been put out there into the atmosphere, but it's going to be out there in the atmosphere, is that all people who are doing direct services, so that means our grant programs, it's not going to just be clinicians or intake specialist ones, it's going to be also SOC, HT, who are also, and to be honest with you, so as we speak, there's some thoughts that are coming to mind. Even VRP can also, because I know you guys do your safety plan, but it's different. This is a safety plan to keep someone safe. So now anybody screening in at moderate risk, they're all going to be trained in learning how to do the safety plan. So the safety plan is a big philosophy of what Zero Suicide believes in. They believe if you can get someone to a safety plan, get someone to where they have someone on their side, on their safety plan, that's a contact person, that they have a way to say, I care about you. They go through a whole safety plan procedure that eliminates suicide. That's a tool to eliminate suicide. So we're going to be training all of our staff who do direct services, starting from the clinicians, all the same safety plan. We're going to be doing the same safety plan. So I'm excited about that. That's a new thing that we're going to be implementing.
Oh, that's amazing.
Yeah.
I know, because we, like you said, the VRP, we do have a safety plan, but it's focused more towards our victims and what they can do for themselves. But this one's targeted more for somebody in a suicidal thought, right?
Yep.
So when we're talking about that, and then Jeremy brought up the QPR is more focused on recognizing those signs, right? So how is that, the QPR and the Zero Suicide, are they intertwined, or is there something that kind of separates it?
I think identifying someone who is suicidal is the name of the game if you're working in suicide, you want to be able to teach people how to identify someone who is suicidal. And I think obviously Jeremy's training is for clinical staff, it's for community members, it's for anybody, it's for, as we just talked about before, a grandmother taking care of her children, learning how to identify. That's QPR. And that's a beautiful thing. Zero Suicide can and is on board with partnering, and as we do partner. The name of the game and part of the 7 elements is train. Let's make people feel comfortable. Let's have a caring workforce that has an ear to be attuned to know if someone is not feeling good about themselves or are having those thoughts. Our program has a 59% rate of people who walk through our doors who are having suicidal thoughts. 59%. So that's a big percentage of people that we need to talk to. That's a big percent that someone in their daily work life is encountering somebody that is having a suicidal thought. To explore that, the badge explores that in the Ask 5, which is the actual suicide screener. And what that Ask 5 is trying to get at is what is their intent. You know, when someone walks through the door and I'm encountering someone who may be saying they just hate their life, you know, I don't want to live. I'd be okay if I wasn't here tomorrow. That type of language.
Right.
And so it's like, okay, so the Ask 5 can give history, they can give you a current thought process, and then it asks the question, are you having thoughts of killing yourself? So that's what the Ask 5 does. If the person indicates in any of those questions, let's say they don't say they're having thoughts of killing themselves, but they have a history of having thoughts of killing themselves, or they're having, you know, maybe having some thoughts of not wanting to be there, that's why the PHQ-9, they work together, because the suicidal ideation and the PHQ-9, which is a depression screener, work together. That's why we use them together, and then ask questions with the PHQ-9 and get more of a risk assessment of where they're at. And then we have a pathway for that person once we know what risk level they're at. So QPR, zero suicide, what we're trying to implement in our policy and procedures, the badge, work together, and I think it goes along the lines of knowing that.
Yeah, I can probably speak a little to that question as well. Essentially, what's the difference between zero suicide and QPR? So zero suicide is a grant where there's a list of objectives that need to be completed, and so what Christal would be working on is changing policies within our behavioral health program. That way, it suits the people that we serve more adequately, and then so that's the focus is inside the program. And then QPR is a training that is provided to people out in the community. So anybody and everybody can take
Thanks,
QPR.
Jeremy.
Yeah.
Yeah.
So
Understand my mumbo jumbo.
Yeah, exactly. So it's designed to be a service that is provided for people in the community. Anyone can take the QPR training, and if you're watching this, if that's something that you want to do, you can absolutely reach out to us here at Yakama Nation Behavioral Health. I would be happy to coordinate a training for you. What we do is we teach steps to take if you come across somebody that is suicidal, or that if you think they're having thoughts of suicide, so I think that's kind of the difference between zero suicide. The focus is on internally within the program, and QPR is out in the community. But definitely, it's something that works together for sure.
Okay. Okay, well, do you have anything else that you want to add or you want to share?
Jeremy, can you pull up maybe the projects? Let me see. Let me roll on over. Okay. I kind of wanted to share a few of the projects that we have going as far as zero suicide. I'm kind of proud to announce, of course, we've talked extensively about the badge, so you know that's a project. But the two highlighted links there are actual links that actually put Yakama Nation Behavioral Health on the map. So we have caring messages that help with supporting our community and saying, how are you? So we've learned through zero suicide and all the research that has been made, if we just make that step to connect. Man, I haven't seen you for a while. I can't get a hold of you. We send out these caring messages. There's an amazing story of the man who jumped off the San Francisco Bridge, that when after that he received messages and letters, and he said, man, if I were to receive that before, I think it would have saved my life or saved that decision. And so we've implemented carrying messages. That's a project that I'm really proud of. So anybody who wants to go to Zero Suicide and type in Yakama Nation carrying messages, we're on their national website. So that's a project that I'm super excited about. Of course, we've talked about policy and procedures and being a part of the self-harm workflow. We've partnered with Veteran Affairs because zero suicide one of our focuses as a grant is to work alongside veterans and veteran suicide. That's a big partnership that we have. And then also working with the Naknuwisha program and presenting. And then also we offer trainings and equip our clinicians and lay staff in suicide care. And that's a part of the training and equipping. And then you could take that off. So the lasting project that I'm excited about after working on all these things is that we're working on a post-vention systematic approach where I want to have an organizational chart where clinical director, we have designated therapists who know what they're doing, know what's going to happen when we have a post-vention event that we need to conduct. And of course, the grants who are going to participate. I want to bring post-vention training to that organization after I get it together. And I'm excited about that because we had a recent issue where we need to step up our game in our post-vention. And I'm excited to be able to work with Jeremy because they're going to be working on post-vention with the Native Connections grant. And
So you're using the word post-vention before you
Oh,
continue
sorry.
to go on. Can you share with our viewers what post-vention is? For
So
those who don't know?
post-vention is actually after someone has completed suicide, that we reach out into the community and that we help any community members with any issues that may be going on. It's basically doing an outreach and debrief of, man, what could we have done? How could we have done this better? And it's also, post-vention is also an inner program workings because as a clinician, it's hard to lose people, right? Mm-hmm. And it's hard to say, I did everything I could, but then there's inner workings of, did you really do everything you could do? There's finger pointing, and we don't want that.
Right.
We need, like you mentioned, self-care. We need to have a debrief within our community to say, man, we're on each other's side within the program, and then with showing the program or showing the community that we care. Mm-hmm. And we want to do this better. This should never have happened.
Right.
And then the inner people who are having the trauma within their own hearts of what could I have done better for my client. And so that's post-vention in a nutshell.
So I like that you bring up the subject of post-vention. That's something that I try to bring awareness to whenever I provide QPR trainings is explaining, I think of suicide prevention work in 3 categories. So there's prevention, intervention, and then of course post-vention like you mentioned. Mm-hmm. So intervention would be things like learning how to deal with and cope with everyday stress and anxiety and depression. Mm-hmm. If we can learn to work through some of those adversities in our daily lives, then that will help prevent us from ever getting to a point where we are thinking about suicide. So that's prevention work, where we want to prevent people from getting to a point where they're thinking about suicide. Mm-hmm. Then intervention is when somebody is thinking about suicide, what do you do? What steps do you take to get involved and to intervene mm-hmm. and to help that person in that moment? And that's what QPR is designed to do. It's an intervention training. Mm-hmm. Then there's, as you mentioned, postvention. So when somebody does die by suicide, we know that can have a domino effect. We know that can potentially cause other people to have thoughts of suicide as well. So what can we do as a program to work in the community to help everyone grieve and heal in a healthy way mm-hmm. so that we can prevent additional suicides from happening? So postvention is doing work, figuring out what work we can do to follow up within the community.
So that's program projects that I wanted to share, but I also wanted to share a last webinar that I went to that I want our community to know that is available. So if it's up there. So what's new? The Tribal Behavioral Health Crisis Service. This webinar was awesome. So what is the Native and Strong Lifeline? The Native and Strong Lifeline is an American Indian Alaska Native specific suicide and crisis line. The NSLL will be operational 24/7, 365 days a year. Calls are answered by other natives. So Native and Strong. So I'm kind of, ooh, I didn't mean to do that. Sorry. But The reason why I feel like this is something that is exciting, I'm excited about it, is because it's going to be something that's implemented where all across the United States, if you want to call, their program goal is if you dial 988, and I think they said if you press 3, you're going to get contacted by a Native American person somewhere in the United States. It's a Native person. And so that's exciting to me. And not only are they going to connect you to a Native person, they're going to be able to do research for you to do either just purely Native programs that are in their area, or they're going to do, if they want a non-Native organization, they'll do a non-Native organization. And actually, it's called this Native Hub, where they actually do follow-up calls with the people that are working with them. So I'm so excited because that's like who we all need help in this area, and it feels good not to be alone. And so I'm excited for that new program and resource that is going to be available to us, all of us.
All right. Well, thank you so much for sharing, and thank you for being here. This was Understanding Behavioral Health. My name is Bao Ashu. I'm a victims advocate for VRP.
And once again, my name is Jeremy Garcia. I work for the Suicide Prevention Program.
And I'm Christal Brown. I'm the project manager for Zero Suicide, and I want to thank Bobby Joe for inviting us because this could be a heavy topic. So, but to talk about it is good.
So just a reminder that there are numbers that you can call, and it will be posted up. So if you want or if you need to have a conversation, those are the numbers you can reach out to. Thank you.
Today's podcast is about suicide. If you or anyone you know may be having suicidal thoughts, please call and ask for help. Please contact the National Suicide Hotline 1-800-273-8255 or 998. You can call us here, Yakama Nation Behavioral Health, 509-865-5121, extension 7633. In an event of emergency, please call 911.